Hello everyone, welcome back to Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shenaz and this video is about the 6 C's of nursing. This is my second video on this topic. My first video that I uploaded on my channel Nurses, the Heart of Healthcare was about 6 C's of nursing. Then why am I making it for the second time? It is, when I was making my first video, because 6 C's of nursing is a very dear topic to me. Yes, I strongly believe in it and I always try to practice it. Okay. Because I believe that these are the essential building blocks for the nursing practice. Okay. So when I was making my first video on this topic, I was so excited that I want to introduce about the channel. I want to tell about my intentions. I want to tell about the topic, and I think in that excitement and during the process I repeated many of the sentences, words. So I think it was not that impressive and could not win much of the hearts, but still I never thought of deleting that video because it was my first attempt. Yes, and it is very special to me because I learned a lot from it. Yes, so I thought, okay, let me make one more video on the same topic in a concise manner, which could win the hearts now at least. Okay, so let's move ahead. But before moving ahead, a small and gentle reminder to all my lovely viewers that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. Okay, now coming to the 6 C's of nursing. What are these? The 6 C's of nursing are care, compassion, competence, communication, courage, and commitment. Okay, and these 6 C's of nursing were introduced by a beautiful lady named Professor Jane Cummings, the former CNO, Chief Nursing Officer, NHS, England. Yes, she is the founder, I can say, of the 6 C's of nursing. Okay, beautiful lady with beautiful thoughts, or I can say very strong thoughts to bring about a great change in nursing practice. Yes, I have one more beautiful picture of hers. Yes, okay, I really appreciate her. She is a live motivation for everyone because, she was the most appreciating thing about her is before progressing into such a big managerial role, she was also a nurse in specializing in emergency care. Okay, and with her sound knowledge and skills, she progressed into such a big lead. Okay, so hats off to you, lady. Okay, then now coming to the 6 C's of nursing. What is the purpose of the 6 C's of nursing? The purpose of the 6 C's of nursing is to ensure that patients are looked after with care and compassion by competent healthcare workers who communicate effectively and who dare to make changes in their nursing practice to improve care, and who are committed to do this all day and every day. It's not about one day that one day we are giving a compassionate care, committed and everything, and then next day we are dull. No, we are supposed to do it all day and every day throughout our entire shift and every day. Okay, so that is the purpose of 6 C's of nursing. Okay, 6 C's of nursing are it's a foundation. If we build our nursing career on this foundation, surely we'll succeed. Okay, they are fundamental, they are essential building blocks for establishing a therapeutic relationship between a nurse, a patient, and the patient's family. Okay, so let's empower this within us. Okay, now coming to the first C, that is care. As we all know very well that nursing is a caring profession. There is no curing without caring. Yes, a good nurse always strengthens her patient with proper nursing care. No matter how busy her shift is, no matter how challenging the patient is, or patient or even sometimes patient's family is challenging, no matter how challenging it is, she always tries her best to provide best care to her patient. Yes, because caring defines us and our work. Yes, so a good nurse always try to provide good care to her patients. Okay, so this is what is care about. A simple example of care what I can give is when a patient is talking to you, or when the patient is telling you something, maybe a complaint, or maybe asking for some need, maybe a physical need or emotional need. Okay, just turning our face and our complete body towards the patient. Okay, keeping an eye contact with the patient and listening to them attentively shows that we care for them. Yes, the patient feels that yes, this nurse cares for me. She is listening carefully to whatever I am saying without interrupting them. Yes, so this shows that yes, we care for you. Yes, we are listening to your needs, and yes, we'll try our best to meet them. Yes, okay, this is just a simple example. And no doubt, to provide adequate care, nurses should have sound knowledge and skills. Yes? Okay, so this was about the first C, that is care. Then coming to the next C. Okay, the next C is about, the next C is compassion. What is compassion? Compassion is to suffer together or to understand. It is something more than pity, right? It's empathy, feeling what exactly the other person is feeling and trying to act for it. Yes, compassion is nothing but it's a sympathetic consciousness of others' distress, and together with a desire to alleviate it. Okay, it is like, we are making the patient understand that what they are going through. We understand what they are going through and we will act for it. Yes, understanding what an opposite person is going through and to act for it, to alleviate it. Okay, so compassionate care is based upon what we say, empathy, respect and dignity. Yes, compassionate care makes the patient feel more comfortable. Yes, that you care for them more. Yes, so a compassionate care is a compassionate nurse is always empathetic. Okay, compassionate care makes the patient feel more comfortable, and a compassionate nurse they make their patient feel better always. Yes, feel them cared. A simple example of compassionate care is what we can say, knocking the door before entering the patient's room. Yes, okay, it shows the patients that we respect their privacy. Yes, so this is also a kind of compassionate care, listening to them carefully without judging them, apologizing when we make a mistake, and learning from our mistakes, and providing emotional support during the critical times of the patient care. Yes, all these are a part of compassionate care, which is very important for a nursing practice. Okay, now coming to the next C, that is competence. Yes, nursing practice requires constant updating of our knowledge and skills. Yes, nurses need to constantly update their knowledge and skills in order to remain up to date with the latest practices. It's not like once we have done our BSc, yes, we are done with the studies, we'll keep our books aside and just finish. It's not like that. We need to constantly update our knowledge. We need to constantly update our skills to provide the best quality of care, the highest standard of care for our patients. Okay, so we need to be committed. We should have that self commitment for improving our knowledge and skills. Okay, so competence is very important. A good nurse is always a competent nurse. The fourth C is communication. Communication is our big goal now. Yes, so nurses need to communicate effectively, not only with the patients but with the patient's family and with the other healthcare team members. Yes, because nurses work with a wide range of healthcare professionals. Yes, with a wide range of people, so they need to communicate effectively, may it be verbal or non-verbal. They need to communicate effectively because communication is an essential part of the nursing care, and it has a great impact on the outcome of the treatment and the procedure. Okay, so we need to communicate effectively in a very simple and concise way. Okay, and what we say, it is our biggest goal now. Okay, the fifth C is courage. Yes, courage enables the nurses to make the right choices throughout their career and to do what is best for the patients. Yes, see, nursing is an ethical practice where which requires moral courage to speak what is right. We should have the courage to speak what is right for our patient. Yes, we do have the right to speak to what is right for the patient. Yes, so whenever we see that something wrong going on with the patient, so we have the right to speak up. If we care for our patient, we need to speak up. Okay, so we should have that courage to take the right decision for the right patient, and to speak up when we have concerns. Oh, so nurses must be, courageous to do what they think is right. Yes, they should be brave enough to confront any kind of fear or difficulties. Yes, because we don't know, we face different kind of patients each day and different kind of families each day. Yes, so we don't know what challenge or what difficulty each patient is bringing for us. So we need to be courageous to deal with the patient, with the patient's family, and with the healthcare professionals respectively. Okay, and during the entire process our care should be patient centered care. Okay, fine. Then the next C is commitment. Yes, that is, we are talking about the professional commitment here. Yes, professional commitment, that is the sincerity, the passion for staying in the profession, and a sense of responsibility towards the hurdles and challenges in a profession. Yes, as we all know that nursing itself is a challenging profession. Yes, and we face different hurdles during our practice. So we should be using our critical thinking skills and sound knowledge and skills to come off these hurdles and do our work effectively. Yes, so nurses should possess high level of commitment to their role. Okay, because it's not an easy job and it's not everyone's job. Okay, so nursing professionals should have that commitment to their patients and their patient's family. Yes, and their care should be always a patient centered care. Okay, so this was in short about the 6 C's of nursing, that is care, compassion, competence, communication, courage, and commitment. So I am sure that if we build our career on this foundation, then it will be a great success. Okay, so if you found this content helpful, then please do subscribe my channel and like and share my videos. Okay, and thank you so much for all your valuable compliments and comments. Okay, thank you.